Hi, thank you for joining us for another edition of Inside the Practice. I'm your host, Sarah Boylan with ePractice Manager, and our hope is to be your number one resource for anything that is dental related. So I'm here today with my special guest, Kassie Anderson. Kassie, thank you so much for joining us.
Absolutely.
So, Kassie, would you like to go ahead and just introduce yourself?
Absolutely. A little bit about me. I graduated in 2015 from Mount Hood Community College. I've worked for two fabulous dentists in the Portland area. I was in Wilsonville for 6 years, and then most recently started with Dr. Kennedy in Portland off Lombard in 2021. And our journey kind of started when he delivered a Christmas gift, one that I didn't know that I even needed or desired, but they were airflow prophylaxis masters from EMS, and I had not heard of air polishing past ProfiJet. So I was interested but nervous because it was an expensive investment and nobody came to install it or set it up or teach me how to use it. So I utilized YouTube and videos that were helpful to put it together, started using this technology, and in 2022 became a trainer myself because I wanted to help other hygienists that were needing to overcome the hurdles or the problems that they were having with their device, but really just not being properly trained. So I've been doing that since October of 2022 and trained over 50 dental offices as far as North Dakota and most often in Seattle and Oregon. So
Wow, that's awesome. I am. So when you first introduced this technology to me, I mean, let's just be honest. I'm clinically what people would call a wuss, and I have had to have my lower anteriors anesthetized for forever. I have a lot of gingival recession, and on the legal side, and so you were always having to numb me. And then one day you just came to me, you're like, "Got this new tool. Let's try just giving it a shot without giving you any anesthetic." And I was reluctant, but I'm so glad I said yes because now I can get my teeth cleaned without having any of the zings or, you know, quick little jolts that I have in your chair. So, can you go ahead and just give us the overview of like what is GBT?
absolutely. It's a systematic, predictable approach to biofilm. So, biofilm's kind of also known as plaque. And we disclose every patient to make it visible so that we know that we're 100% removing it as best as our ability. And then we kind of follow up with an ultrasonic, piezo technology, particularly. It's all warm water, 104 degrees. And then the hand scaling or the checking yourself is our last step. And that is just to obviously utilize our skills that we have as hygienists, but we're definitely relieving a lot of that hand instrumentation fatigue and burnout of really kind of chasing plaque that we never uh, knew how sticky it was and how difficult it was to remove. So airflow makes it easy and fun.
That's amazing. So I know that one of the things that I really appreciated is so let me be honest with you. I appreciate the education, but I'm also a little embarrassed when you do the disclosing agent and you're like, oh, that's up to 72 hours, you know? So every time I come to see you now, I am making sure I'm in there with the sonic care and making sure that I'm getting as much biofilm off my teeth as I possibly can before I come and see my friend. But
Yep.
um, talk about a good tool for the toolbox to be able to do patient education, right? Um,
I try to let patients know too, there's no, the pink biofilm or the early, not mature biofilm is no big deal, so that's an encouragement. And then we're really just pointing out the acidic, harmful biofilm that could, cost you money in the dental chair, cavities or inflammation, not good for your whole body. So we're trying to promote it in a way that's not negative or shameful, but more like, let me help you help yourself so that you don't have dental problems.
yeah, exactly. And it's up to like what, 72 hours, did you say before?
Correct, but what's crazy is it's 72 hours or longer, so we really don't know how long some of the biofilm has been on, and I can tell as a clinician, there's definitely a difference between maybe just 72-hour and, "Oh, man, has this been 3 weeks, 4 weeks?" It's really stuck on there, and it takes a lot more effort to remove.
Yeah. Oh my. Well, disclosing agent's been around forever. I'm looking forward to trying it on my 3-year-old here before too long to start pointing out where the sugar bugs are, and we're big time big time brushers. I gotta be honest with you, flossing a 3-year-old is it's challenging sometimes, but I'm really hoping that, doing this closing agent on her is gonna be super helpful. So I think is there 8 total steps to the
Yes.
GBT?
Yes, I brought my cute little thing to kind of show. Or number one, we're always going to assess our patient. So, kind of the biggest things we're looking for would be uncontrolled disease that you, as the clinician, maybe don't feel comfortable treating that day. And that could be a wide variety of things. Maybe somebody had a heart attack or stroke within 6 months. Maybe they don't know a clue about their diabetic condition and they're, looking unwell in the chair. If they have a contagious maybe virus, you can hear them coughing in your lobby. So things, respiratory conditions we are careful about, if somebody has COPD or something like that. But besides assessing, we always make sure we're disclosing every patient. I don't present it as an option. I kind of let the patient know that that's going to be my roadmap. It allows me to know where to go and also how long to stay on the tooth. So for their benefit, we're not over instrumenting. After we do our disclosing, we're going to motivate. I also don't ask for permission to motivate because I think you lose a great opportunity to be able to show the patient like this 72-hour biofilm that you were missing was actually causing inflammation. And this is why the gums are bleeding. That was why it was more tender. So if you don't show, you really miss that opportunity. Airflow would be the next step. So that's removing soft biofilm stain and plaque from the tooth up to 4 millimeters under the gum. So that is great technology to be able to disrupt biofilm subgingivally. The perio-flow is as needed, so that would be for your periodontal patients, 5 to 9 millimeter pockets. You can actually disrupt biofilm on the wall of the tooth or implant, the tooth gingival tissue in the base of the pocket. So you're getting kind of triple spray. The peri-piezon, I'm sorry, is your ultrasonic. So that is your hard deposit removal workhorse first. So we always present that to the patient as it's gentler than a hand instrument, it's removing less tooth structure. So it's in your best interest, even if maybe a Cavitron has not been your favorite in the past because it was cold or zingy. I always try and encourage patients to give it a try. And then hand scaling or checking yourself last, making sure you don't miss anything. We love to do that as hygienists, make sure we're good. And then our recall can be based on how, what we saw with the first step with disclosing. If there was a lot, we want our patients to come back a little sooner for some more motivation. We would recommend 3 and 4 month recalls pretty routinely in my office because when I see the need, I don't base my recommendation off the 6 months, what the usual insurance coverage is, but more so what I see that they need.
Yeah, no, I think that's great, and I'm one of them. I like to come in every, 4 months at least to get my teeth cleaned. Even if I have to pay out of pocket, it's worth it just to, I get so much buildup in those lower anteriors, so it'd be great to get in more often. Um, so that's a really good system that you have. Can you talk to me a little bit about the difference traditional polishing though and the airflow polishing? Like, what are your differences there?
I would describe traditional prophylaxis as, a Cavitron hand scale and polish at the end. There are a lot of hygienists that have adopted the polish first method. So I would say this treatment is for you. You are the leaders in recognizing that polishing first does help you get the calculus a lot easier, detect it. So we find that with traditional polishing, you have areas that are inaccessible to reach with traditional prophy cups. So your occlusal grooves, your root surfaces, if they're too sensitive. A lot of times, we cannot reach around brackets in orthodontic patients. So you have a lot more access to the biofilm with airflow than you would with traditional prophy. And I prove myself of that when I have to do traditional polish on 1 or 2 patients quite literally in my office because everybody else has really enjoyed and adopted guided biofilm therapy very well. But for those patients, I say, okay, well, I'm going to do the same steps. I'm going to disclose your teeth. We're going to show you where it's at. And then I'm going to try to remove it with the prophy angle. And what I find is that patients are kind of like, oh, that doesn't feel good. I don't like that. And I'm like, well, I'm trying to get it all off, and with airflow, I could have been away from the tooth using gentle pressure washing, warm water. So, a few of those patients in the beginning have fully transitioned, obviously, to guided biofilm therapy, but we're all in the customer service business. So, we do what we have to do, but it's validating to me.
Oh, absolutely. So in the beginning of our show, you said that you had to go to University of YouTube to learn how to, put things together and all that sort of stuff. tell me more about your training. You're going into these new offices, like, what does that look like? And what are hygienists' initial response to this when the doctor purchases it?
Yeah. So in Europe, where it's very popular and much the standard of care, there's actually centers where you can go as a hygienist if you seek guided biofilm training. So you could go and get a certificate yourself and be certified as a hygienist. In the US, we don't really have that system set up yet. So we only are training offices that have already purchased a unit, and we're just offering. Well, not offering, we're requiring that, hey, when you purchase a unit, it comes with training. We will send a trainer out to your office. It is 6 hours. You have a theory portion and a hands-on portion where you work with the team, and it's really great. It helps you take care of your device so you don't make any critical mistakes with cleaning and maintenance. And it allows you to know all the benefits of being a certified office and all the little troubleshooting things that I had to learn the hard way. I feel like trainers usually offer those up front as because we're most all clinicians too. So it is beneficial for us to give you that information.
Yeah, that's awesome. How do you go about doing that? And do you feel like that has been something the practice has been able to, you know, step up with?
Yeah, I feel like my practice has not had to market it very much on our own because I guess one of the certified practice benefits is you do show up on a practice locator map. So patients that have heard about guided biofilm therapy can, type in their zip code, quite literally see what offices in their area have GBT. And then we have had patients call to schedule for that reason specifically. But as a certified practice, you do get a whole slew of marketing resources. So pre-templated slides with, what it is that you can post on your social media, an email newsletter to your patients that you can send out, letting them know what you're offering now. So you are equipped with all those resources once you become a certified office. And then also just, word of mouth and those kinds of things. It's happening really naturally.
Nice. So if any of our listeners wanted to find out more information or be able to, let's just talk about the cost of these things. Like, what does a unit run for starters?
Yeah, I do the dental conventions with the experts who are the reps in the area that are giving the quotes and working with your local dealers, Patterson, Burkhardt, etc. And we usually, as a safe estimate, will say it is 16,000 to outfit one operatory for hygiene. And the reason we say that is there's the device cost, and then each set of hand pieces, one airflow for every patient, one piezo, is per patient and needs to be ran through sterilization. So we quote you for 3 of each. And then you also get a perio flow. You get a slew of tips. You get the training. You get some 4 bottles of powder to start. So it's like a starter kit, but we quote 16,000.
So what is in the powder kit? Like, what is it?
Well, the powder itself is erythritol, so we're talking 14 microns. We have a patent on the powder. And sodium bicarbonate, which a lot of people know as the ProfiJet, that's about 40 to 60. So a much smaller particle size. That's why it's so safe subgingivally. But the powder itself, erythritol, CPC, which is kind of a agent that helps the powder not have bacteria grow and things. And it's very liquid-like in property almost. There's no water at all involved in the air powder slurry of the chamber, but when you move it around, I mean, it's so fine of a particle, it almost looks liquid-like, super comfortable to the patient. They're not feeling that pins and needle feeling as I have felt myself with like a ProfiJet, get them white no matter the cost. And you're like, yeah,
And I guess what I appreciate it is about it is the fact that I don't come out of your office chair feeling like I just had been sandblasted, right? Like there's no major salty taste. There's no, grime on my, my skin or anything like that. I don't have to go home and redo my makeup. Like it's very gentle. It's a pretty cool technology for sure. And the fact that I don't have to be numb anymore in your chair is awesome. Like, I'm not it's funny, like, I'm not afraid of needles, but I'm definitely afraid of those little zings that I'd get, and I just don't have those anymore. That's awesome.
yeah.
Um, okay, well, what else could you, tell us to other hygienists, doctors, what other
I would
things?
I would say, Guided biofilm therapy has switched my mindset a little bit from being so concerned about the calculus or charter. I obviously still have a job and a duty to get that for my patient, especially in the areas that they can feel. I want their teeth to feel smooth. But biofilm is the living, talking community of organisms that are wreaking havoc on our immune system and our systemic disease. And so being able to be more concerned about that with my patients, actually doing oral hygiene instruction every patient. I'm usually getting out a toothbrush or an interdental brush or what can I give you to help you reach those areas. And it feels much more rewarding. And I feel very lucky to work, for a dentist that just dropped this on his doorstep, our doorstep quite. And I had to learn and adopt, but it goes two ways at dental conferences. There's the hygienists that have heard about it and are longing for it. They want it for their career. They want it for burnout. They're so desiring it, but the cost, I'll never get it. And then we have the opposite. The dentists, like Dr. Kennedy, the COIS Center is a big place where they have been trained and presented scientific research on EMS and our successes that we've had with guided biofilm therapy. There's PubMed articles that discuss the benefits of guided biofilm therapy using EMS systems. So when you hear that as a dentist and you care, a lot of times it's them that are driving the change in their office or wanting the hygienist to come along. So if you're that hygienist, accept the gift, put the Cavitron away, and I promise it'll change your life. And if you're the hygienist seeking that, I think there are dental offices for you too that are, wanting to attract those hygienists.
So is there financing available? Like anything we can do for capital equipment wise for
I
doctors?
I'm aware of a few, like, so Czech, Patterson, Burkhart, those types of things. They might do small equipment financing or something like that. I mean, this isn't
Mhm.
small equipment, but you know what I'm saying, equipment financing. So check that out. But as far as like big sales during dental conference, not really usually something that we do, but we do have an e-shop where you can oftentimes find like instrument tips, buy 3 get 2 or something like that. So there's some sales that are ran on the eShop occasionally that are worth looking for.
Awesome. Um, so I guess how would any of our listeners get in touch with you as far as being able to ask you questions, or do they contact EMS directly? Um,
Yeah, I would say we have local GBT experts, so you can definitely go online to the EMS website and like request a demo or request a virtual, and that would put you right into the inbox of a local expert in your area. And then I, am here for anybody in the Portland area, especially if you have a device and you are not trained and you're, interested in what that is. They can definitely reach out to me. I have, not the most crazy, it's just my personal social media, but Kassie Anderson _91. You're welcome to reach out to me that way. Otherwise, Kennedy Dental off Lombard is where I work. I'm sure if you call my office and you ask to talk to me and leave your number, I will call you back. And I am also, a success coach for EMS. So I do have business cards and things that I can, hand out to offices if they need help specifically with their device. So I'm around.
awesome. Thank you so much. All right. Well, thank you again for all of your time, your expertise. Again, as a patient, I'm a huge fan of this. This has been, you know, ins- instrumental, no pun intended. And my change of my oral care habits, even after being in dentistry for 20 years, there's always opportunities to learn more. So, thank you again, Kassie, and to all of our listeners. If you have any questions, please feel free to reach out to myself, Sarah Boylan, e-practice manager